My name is Jamie Eisenstein, and I live in Southeast Portland too. I am a 10-year breast cancer survivor and a member of the Lymphedema advocacy group. I wanted to speak with you today because 40% of breast cancer survivors, including me, and 15% of cancer survivors overall develop a lifelong chronic condition called lymphedema as a result of cancer treatment. Having lymphedema means that I am at high risk for infections and other complications. I must be diligent about controlling the swelling in my affected arm and hand in order to reduce these risks. And the most important component of my treatment is the use of doctor-prescribed medical compression garments. Unfortunately for me and millions of other lymphedema patients, these medical compression garments are not or barely covered by insurance. As such, I cannot afford to buy more than one set every year. This means my compression garments are stretched out and no longer as effective. They have unsightly stains and tears between the fingers like this on the gloves. And so that as my hand swells throughout the day, my skin painfully bulges through these holes. Despite my efforts, I usually suffer from at least one cellulitis infection per year. If I was able to control the lymphedema better with properly fitting new compression garments, I would not be as susceptible to these infections, and my insurance would not have to pay for these emergency room visits. Due to COVID, I am even more worried about developing an infection when now is not a good time to go to the ER. I know that you are chair of the Senate Finance Committee, and I want you to know that there is a bill before your committee called the Lymphedema Treatment Act that will close this unintended gap in coverage. The Senate bill number is S1315, and this legislation has 72 Senate co-sponsors and 337 House co-sponsors. Enactment of the Lymphedema Treatment Act is projected to save Medicare over $1 billion.
This would be a bill, so I can get it, because I was just getting you, and you really started to get right. No, you did very well. But this is a bill that would allow Medicare to pay for these important treatments. And the argument that is relevant, and you've made it very eloquently, is, hey, Medicare, you're going to save money, because if we had our gloves, we wouldn't be going to emergency rooms and the like. Okay, yes. Good.
Also, when I have tried to get insurance to cover these garments that are prescribed by my doctor, they need a code, and the Medicare has to
coverage
invent the code.
Are you receiving Medicare today?
No. I have insurance. It doesn't have a code. It is very difficult to get them to cover the garments without this code.
So okay, yeah, because this is kind of the area I specialize in. So I ask questions, I can kind of figure out how to move things along. So this is a service that makes a lot of sense. And are you interested in trying to extend this to all who have this healthcare challenge and are over 65, or do you wish to have Medicare pay for it for people of any age who have this problem?
Everybody. There are plenty of children who have this problem. We all get cellulitis and we all end up in the emergency room because we need to have good fitting, high quality garments that can be replaced. I have to wear these. This is I'll show you.
How much do you?
This is the garment that I have to wear. Yeah.
How much do you think it costs to get the garments you need for a year?
Well, so I looked at how much I paid, and I paid $900 per garment, and that's out of pocket. And then I also have to wear a night garment, which I pay $430. And I have to wear this all the time. So I would love to have a garment for every day of the week. So I only had to do my laundry or to wash them, once a week. But in fact, now I have to wash them every night, or sometimes I wear it a few times and then wash it. And I'd rather have clean, fresh garments.
But
the thing is that's important.
I was just doing some math, ma'am. So if you're spending $1,330, which is the 900 plus the 430, and you need them for 7 days a week. So let's just see if we can get in 21. You're talking about under $10,000 a year. And even one or two of these emergency visits will be much greater than the 10,000. Okay.
You got it.
I got the math there. I will tell you, and you know what I do always when I hear something at a town meeting, I always say I'm going to under-promise and see if I can be useful. And you've really got a good argument here. Now, a lot of my colleagues probably will say, hey, we're for Medicare. It says Medicare over 65, some exceptions. Well, what's Ron going to do? Is he going to start giving Medicare to people who are 16? Now, because I think this just makes a lot of sense to do it. The private insurance companies, is there any private insurance company in America who will give you 7-day-a-week coverage?
For these garments?
Yeah.
I've never seen it. We need Medicare to set a precedent for the private insurance companies. Right. I have actually had insurance that will cover 2 every 6 months, but that's not enough, and because they wear out so quickly. So do you have a private policy that covers 4 a year, 2 every 6 months? I currently have. So I was living in New York City until last year, and then I moved back to my hometown of Portland because of coverage problems. I had Oscar Health Insurance Company in New York, and they would not cover anything. Then I moved to Oregon because Providence covers 2.
Got it. 2 every 6 months for a year.
Yeah, 2 every 6 months.
Let me do this. You've made a very compelling case, and I've asked questions because I really wanted to understand it. We'll make sure folks from the Senate Finance Committee who specialize in health get back to you. Okay.
Thank you.
Thank you. Sorry that you're having to deal with this. It's like everything else. Healthcare is the most important thing. If you don't have your health, everything else goes by the board. So we'll get to work on it.
Thanks so much for joining us, Jamie. Next up, we have